I'm a senior. I'm here to represent Friends of Medicare, on which I sit as a board member, and also the Public Interest Alberta Seniors Task Force, on which I sit representing the Alberta Federation of Union Retirees. We've heard that 5,622 people have died from COVID as of March 6th. That's an increase of 40% since last year. The average age of death, though, is 79. 5,107 of these deaths were people aged 60 and over. And as we look at the flowers laid out here, the white, silver, and gold signify the deaths of those seniors who died 60 years and older. Alberta Health Services refers to these deaths as severe outcomes. Nothing is more severe than death. But we've also heard about long COVID from the eloquent presentation of Laura Collison. And I also want to acknowledge that seniors disproportionately suffer from long COVID as well. It's something that has to be looked at more seriously. And nowhere was it shown more clearly than in our long-term care facilities where seniors died. In fact, leading the country at the beginning of the COVID pandemic, in fact, leading the world. 81% of all COVID deaths took place in these facilities at the beginning of the pandemic, and that's shameful. Residents of long-term care and retirement homes continue to be disproportionately affected by COVID, and the seniors who built our country and our healthcare system paid and continued to pay the ultimate price during this pandemic. They died because our continuing care system failed them. It was a tragic outcome for everyone in a system which continues to be understaffed with workers who are overworked and underpaid. Our continuing care system exposed the many cracks formed over decades of privatization and cost-cutting. Many long-standing issues came to light during the pandemic. Insufficient numbers of qualified staff, overcrowding in rooms, poorly paid staff, lack of proper staff to resident ratios, lack of proper testing, lack of appropriate PPE, aging facilities, poor ventilation systems, neglect, isolation, the list goes on and on. Our seniors deserve better. On February 23rd, 2023, Doug Wiley, Alberta's Auditor General, released his report confirming all the above-named deficiencies. He reported that 85% of the staff who worked in continuing care worked part-time or casual, and he said that was a shocking figure, more appropriate for staffing a fast food franchise than a continuing care center, and that is shameful. Long-term care has become and continues to be a multi-billion-dollar industry, commodifying and exploiting our senior population for profit. All seniors should be able to count on our health and continuing care systems to receive the level of care they need, regardless of ability to pay. We're projected as seniors to become 25% of our entire population by 2030, and in Alberta to nearly double in size over the next 20 years. Public Interest Alberta Seniors Task Force continue to believe that systemic change is long overdue, and they made several recommendations in our submission to the UCP government's facility-based continuing care review. But despite this input, the government ignored us. And ignored all the researchers and healthcare community who had been raising alarms about deficiencies in facility-based congregate care settings for more than 30 years. And the recent 2023 UCP budget clearly does not see seniors as a priority. Chris Galloway, Executive Director of Friends of Medicare, has said that the UCP government's approach is to hand public health care funding over to private companies looking to turn a profit at the expense of quality care for seniors. We can't keep treating seniors like commodities. At last year's event, I called on our federal government to step up and show leadership with legislation spelling out enforceable long-term care standards so the kinds of deaths that we saw during the pandemic are lessened, in fact, diminished, because the conditions of work are the conditions of care. In January 2023, the federal government announced new voluntary resident-centered standards for long-term care to focus on physical structure and actual care. Unfortunately, these standards are not mandatory, leaving it up to provinces to enforce. We believe that federal funding for health care and long-term care must be contingent upon the province's compliance with standards and a commitment to seniors' care delivery based on the 5 basic principles of our Canada Health Act. Public Interest Alberta Executive Director Brad LaFortune has called on the province to adopt national long-term care standards, reinstate an independent seniors advocate, improve working conditions, and bring all homes back into public hands. Our Alberta seniors deserve better, and I ask you all to continue to work together to defend, protect, and expand our public health care system. Thank you for participating in today's event, and please visit the Friends of Medicare or Public Interest Alberta websites to sign a letter demanding an independent seniors advocate office. And I want to especially thank Erin Aylward for preparing all these beautiful flowers. It's a shame that we have to have so many of them. Thank you very much.